So let's just recap those numbers again. Gauteng has recorded 3,720 new COVID-19 infections in the past 24 hours. You've heard hospital admissions have increased and 114 new deaths have been reported. So this brings the spike in recorded infections in the province up by 67%, and the national death toll, 57,879. The National Institute for Communicable Diseases reported 5,552 new COVID-19 cases in South Africa, representing an 18.5% positivity rate. The total number of laboratory confirmed cases in the country stands at 1,752,630. Director of the Office of AIDS and TB Research at the South African Medical Research Council, Dr. Farid Abdullah, joins us now. A very good evening to you, and thank you so much for speaking to us. So SAMA has raised concern about the rapid rise in hospitalizations and shortage of beds. Just how bad is the situation now as we speak?
Tippy, so thank you for having me. I think SAMA's concerns are well-placed, well-founded, and it's clear that all public and private hospitals in the province are rapidly filling up. So just to take a step back, our caseload, case rate in Gauteng in the third wave is significantly higher than the second wave or the first wave. But what's even more concerning is the direction of travel. It looks like it's headed straight up, and it's going to increase. Our death rate is not as high as in the second wave, but it's most likely going to follow the case rate, and then we will see even more numbers. So what I'm concerned about, what many of our clinicians are concerned about in the province, is that the numbers needing admission will go up, and we reach a point where we run out of beds. So the wards are full, the emergency units are full, the tents that are in most hospitals are full, and then doctors will have to start choosing patients who get admitted and those for whom they can't find a bed.
I mean, it's been admitted by public health experts that the modeling is not 100% foolproof, so there's some unpredictability to how the pandemic is behaving. But I'd like to hear from you, just considering the work that you're doing, and perhaps you can tell us what influences it. Gauteng, there have been various hotspot areas, but Gauteng is accounting for 67% of the new cases. Why is it so high? Is it something that we haven't been doing that we should have done?
That's a really difficult question to answer, Tsepisa, and you have all sorts of theories and opinions. I think the most important things are that we probably had a smaller first wave and a smaller second wave compared to the Western Cape, Eastern Cape, and KwaZulu-Natal. So we probably have less immunity, and in a way, it's our turn now. It's been the same in the Northern Cape, the Northwest, and the Free State, which have had a big third wave. But in the last 3 to 4 weeks, we've overtaken those provinces. So we are definitely much higher than where we were. But to answer your question, I'm sure that it's got to do with the background immunity that's there, that's lower than the other provinces. But in addition, we're a densely populated province. We're a large province with lots of people. And there would have been large pockets of communities which had not been severely affected. And the virus has certainly found those communities now. But all in all, we can't exactly say what is driving the epidemic in Gauteng, why it's higher than other provinces. What we can say is that we are running out of beds, and we need to do some urgent things about that.
And that's what I want to look into, because on the one hand, we're talking about COVID-19, the pandemic, but there are other or non-communicable diseases that we have to deal with. So the implications of that third wave, is that going to add to undue pressure? Because there are people who do have comorbidities.
Yes, just listening to Dr. Majila from Kalafong, I spoke to him earlier today. I've spoken to CEOs of other hospitals today, including Charlotte Macleke and Steve Biko, where I work as a clinician. I think there's a couple of things here that we need to focus on at this point. There's not a lot of time for debate and discussion and planning for the future. What we need now are the hospitals must look within themselves, like Dr. Majila at Kalafong is doing, to see how he can repurpose beds for COVID. That's the first thing. Mm-hmm. The second thing, probably more important, is that the provincial health authorities need to find ways to bring more nurses back into the system. Even if these nurses are from agencies, and it's hard to find nurses, but it's possible. More doctors on stream. So that's an urgent thing to do. And then probably the most important thing is to see how we can get the main hospital in Gauteng back on stream. Charlotte Macleke, at the peak of the second wave, had 400 COVID beds. And without that, we are really going to struggle in this province.
I mean, in the past, there was concern. In fact, it became a reality, a lack of oxygen that is available, or vents. So what should you be planning for then in terms of resources if the most second higher rate in new infections would be the Western Cape, but they're at 8%. So the national plan, will there be a drive towards that, ensuring that majority of some of these resources, ventilators, are sent to Gauteng?
Yeah, so the one good thing that's been happening in the background is that we've been working with about 14 hospitals and the Solidarity Fund to buy and place equipment in hospitals. And I'm feeling very confident that we have the ventilators, we have the equipment. What we need are the nurses, because the nurses, if you have nurses, you can open more beds. And the physical bed and the equipment, I think, is less of a concern than actually getting warm bodies, there. From an oxygen point of view, and I say this guardedly, but I have, been visiting all these hospitals, looking at their oxygen supply. Between the first and the third wave, there's been a lot of infrastructure work to get the oxygen reticulation properly on stream and make sure that the oxygen pressures at the beds are sorted. And also Afrox, which is the main supplier of oxygen in the public sector, has got 3 plants in Gauteng. So I'm not really concerned about the oxygen at the bedside.
Okay.
But the patients who won't get oxygen are those who won't get a bed. And that's what is our big concern.
All right. Thank you so much for your time and sharing your insights with us. Dr. Farid Abdullah is the director of the Office of AIDS and TB Research at the South African Medical Research Council. So according to the Health Department figures, up to now, there's been a total of 1,777,288 people that have been vaccinated. So he says, bring us more nurses that will help alleviate the pressures in terms of dwindling hospital beds. South Gauteng has seen a spike of 67% in new cases of COVID-19.